Today's lecture is focused on the exciting field of medical nanotechnology, specifically its applications in the treatment and diagnosis of age-related macular degeneration, AMD. AMD is a leading cause of vision loss in individuals over the age of 50, making it a significant health concern worldwide. The use of nanoparticles and nanoscale delivery systems holds great promise in tackling the challenges associated with AMD. Nanoparticle-based drug delivery systems offer a sophisticated approach to target therapeutics specifically to the affected areas of the eye. By utilizing the unique properties of nanoparticles, such as their small size, high surface area to volume ratio, and ability to functionalize their surfaces, these drug delivery systems can enhance drug stability, prolong drug release, and minimize off-target effects. Various types of nanoparticles such as liposomes, polymeric nanoparticles, and dendrimers have been explored for their potential in AMD treatment. Intraocular implants provide a means of sustained drug release in the ocular tissues, ensuring a prolonged therapeutic effect. These implants, often made of biodegradable polymers, can be loaded with small molecule therapeutics or biologics, releasing them over an extended period. By tailoring the release kinetics and implant design, researchers aim to achieve optimal therapeutic concentrations within the eye, reducing the need for frequent administration and improving patient compliance. Nanoscale delivery systems, such as micelles and nanocrystals, have shown promise in delivering small molecule therapeutics to the retina with improved bioavailability and controlled release profiles. These systems, typically formed by self-assembly of amphiphilic molecules, can encapsulate hydrophobic drugs, protecting them from degradation and enhancing their transport across biological barriers. The precise control over their size and surface properties allows for efficient drug delivery and improved therapeutic outcomes. Nanoparticles with unique optical and magnetic properties have revolutionized diagnostic imaging in AMD. By functionalizing the nanoparticles with molecules specific to disease markers, researchers can enhance contrast in imaging modalities like optical coherence tomography, OCT, and magnetic resonance imaging, MRI. These imaging techniques help clinicians identify and monitor disease progression, enabling early intervention and personalized treatment approaches. Stem cell-based nanotherapies provide a promising avenue for retinal regeneration in AMD. Nanotechnology facilitates the delivery of stem cells and promotes their survival, migration, and differentiation within the damaged retina. By engineering nanomaterial scaffolds with tailored physical and biochemical cues, researchers can create microenvironments conducive to stem cell growth and maturation, ultimately leading to the restoration of retinal function. In the field of nanomedicine, a promising approach for treating age-related macular degeneration, AMD, is photodynamic therapy, PDT, using nanostructures. By utilizing specialized agents called photosensitizers and nanoparticles, this therapy has demonstrated significant potential in selectively targeting and eliminating abnormal blood vessels associated with AMD. When activated by light, photosensitizers induce localized cytotoxicity, effectively destroying the targeted blood vessels. The incorporation of nanoparticles in this process enhances stability and enables more efficient targeting, thereby minimizing potential harm to healthy tissues. This combination of technologies thus offers precise control over treatment outcomes, making it a promising avenue in combating AMD. Gold nanoparticles have emerged as promising tools in photothermal therapy for AMD. They exhibit unique properties that enable the absorption and conversion of near-infrared light into heat. This localized increase in temperature can effectively target and coagulate abnormal blood vessels, minimizing potential harm to surrounding tissues. Moreover, gold nanoparticles offer the advantage of performing both imaging and therapeutic functions simultaneously, allowing clinicians to monitor the progress of treatment in real time. This multifunctionality enhances precision and facilitates better outcomes for patients with AMD. Age-related macular degeneration, AMD, is a complex eye disease. However, recent advancements in nanomedicine have revolutionized the treatment landscape. Gene therapy, through the utilization of innovative nanoparticle platforms, has emerged as a promising approach for AMD treatment. Nanoparticles, which are tiny particles with unique properties, offer several advantages for gene therapy in AMD. These nanoparticles efficiently deliver therapeutic genes to specific cells in the eye, enhancing the expression of these genes and restoring normal cellular function. Additionally, their precise characteristics can be finely tuned, allowing for targeted delivery to the affected areas of the eye. This targeted approach reduces the likelihood of off-target effects and maximizes the therapeutic impact. By addressing the genetic abnormalities that contribute to AMD, gene therapy using novel nanoparticle platforms holds immense potential for the treatment of this debilitating eye disease. Nanobiotechnology approaches offer innovative solutions for developing ocular prosthetics to improve vision in AMD patients. By integrating nanoscale materials and technologies, researchers can fabricate artificial corneas, retinal implants, and other vision-supporting devices with enhanced biocompatibility, durability, and performance. These advancements have the potential to revolutionize visual restoration methods for individuals affected by advanced stages of AMD. Nanomaterials play a vital role in the development of artificial retinal pigment epithelium, RPE, constructs, mimicking the functions of the native RPE layer in the retina. These constructs, comprising nanofabricated scaffolds and RPE cells, aim to restore the visual system's integrity and functionality. Nanoscale features of the scaffold promote cell attachment, growth, and differentiation while providing a suitable microenvironment for RPE cells to perform their physiological roles. Inflammation plays a critical role in the pathogenesis of AMD. Nanoparticles can be engineered to modulate inflammatory responses in the ocular tissues, offering a potential therapeutic strategy. Functionalized nanoparticles can specifically target immune cells, delivering anti-inflammatory agents or immunomodulatory substances to regulate the inflammatory cascade. By suppressing chronic inflammation, researchers hope to slow down disease progression and preserve visual function in AMD patients. Non-invasive nanomedical techniques have garnered considerable interest in the early diagnosis of AMD. Utilizing nanoscale probes, biosensors, and imaging modalities, these techniques enable the detection of disease biomarkers or changes in the ocular microenvironment, providing clinicians with valuable diagnostic information. The non-invasive nature of these methods minimizes patient discomfort, enhances accessibility, and facilitates early intervention to prevent irreversible vision loss. In conclusion, the field of medical nanotechnology offers immense potential in revolutionizing the diagnosis and treatment of AMD. The use of nanoparticles, nanoscale delivery systems, and nanobiotechnology approaches allows for targeted drug delivery, enhanced imaging, stem cell-based therapies, gene therapy, and non-invasive diagnostic techniques. As research progresses, these innovative solutions have the ability to transform the lives of millions affected by AMD, improving their visual outcomes and quality of life.